dorsiflexion. Ask our clients to put their hands and slide them down their legs. And then we also have to apply overpressure. So we're not pushing down, we're trying to stretch out. And then for extension, we don't apply overpressure, but they put their hands on their back, and we can hold the hips for stability if they need it. And then they just reach back, look at the ceiling, and then go forward. And then for lateral, using your right hand, slide it down your leg as far as you can. And then we're just doing the same thing. We're not pushing down, we're applying overpressure and stretching out. And then we're going to do the same thing for left side or left hand down the leg, and then stretch out. Oh, I'm watching for any compensatory movements. Watching the hips. And then for rotation, putting the hands on the hips and rotate, and then using the hips and the shoulder to pull, and then same for the other side, overpressure. Okay, so now doing passive shoulder. We'll start with a abduction. And then for horizontal, abduction. And then flexion. And extension. And then horizontal abduction. And then you do external rotation and internal rotation. Okay, so doing ankle resisted, we'll start with dorsiflexion, putting it in a neutral position. Okay, so don't let me move you. And that would be a grade 5. She was able to hold it against gravity, and then was able to hold for resisting. And then for plantar, again, get a neutral position. And then don't let me move you. And again, grade 5, was able to hold against gravity and pressure. And then for inversion, that slightly neutral position. And don't let me move you. A grade 5 again. And then for eversion, just slightly neutral. And don't let me move you. And together. And again, grade 5. Okay, so doing the L4 dermatome, myotome, and reflex. The dermatome runs from the lateral side across the patella down the medial side, and the reflex will be at the patellar tendon, which was positive. It'll also be myotome for dorsiflexion, so just at the neutral position, and don't let me move you, and which is positive. Okay, so we're doing myotome, dermatome, and reflex of C5. The dermatome will run from the clavicle down the arm to the fingertips, and you can use a more blunt object like my fingers to run across. Do you have sensation? Yes. And then you can use the end of your reflex hammer or a pinwheel for more sensitive. Can't really get it through her shirt, but going down her arm to her fingertips. Do you have sensation? Yes. Okay. And then the reflex will be at the bicep, and using your thumb to conduct. You can see the small reflex in the fingers. And okay, so myotome would be elbow flexion, so stabilizing and having her lead with her thumb, and then just don't let me move you. And I'm going to do testing for the supraspinatus. So we're going to start with full can, so having the shoulder with 90 degrees and leading with the thumb, and then getting her to resist me, so don't let me move you. And then to make this test more provocative, get her to do the empty can and lead with the pinky, and again, don't let me move you. And both tests were negative. Alright, so an abnormal or positive would be that she would not be able to hold in either empty or full. Usually positive would just happen in the full and you would not need to continue to provoke it in the empty can. Okay, so we're going to be doing valgus testing for the medial collateral ligament. So we're just going to take the leg, and we're going to be pushing from the lateral side, and we're going to be looking for any hypermobility through the medial ligament, and also if there's any recreation of the pain. And obviously she has a negative test, there's no hypermobility, and there's no recreation of pain. Alright, so I'm going to do the anterior dural test to test the anterior cruciate ligament. So I'm just going to rest my thigh on her foot to stabilize. I'm going to place my hands beneath the patella as well as just underneath with my thumbs. And I'm going to shift forward, looking for any hypermobility, pain, or recreation of symptoms. And she has negative, there's no hypermobility, pain, or the recreation. Okay, so we're going to do the shift and load test, testing the stability of the glenohumeral joint. So grabbing the anterior and posterior parts of the acromion and holding the shaft of the humerus up more anteriorly close to the head. And we're just going to externally and internally rotate, and hers is negative, but a positive, you would feel and hear the clunk and shift as it comes off or onto the labrum, but hers is normal.